Do you like your health information to be secure? Would you like the sharing of your health information to be both more streamlined and in your control? Well, if you answered yes to any of these questions, then you'll be pleased to know that Unity offers the solution to them. First, I would like to introduce you to our team. We have Keegan Bursky, myself, Evan Burge, Isaac Soloway, Upashna Shrestha, Sydney Sauer, and our advisors, Jin Yao and Louis K. of Cummins.
So as more and more technology is integrated into the healthcare system, it faces some of the same challenges as other technology-driven sectors, such as loss of data, privacy issues, increasing distrust from patients, as well as slow or inability to access information that has already been stored. Thankfully, Unity provides a unique and secure solution that not only caters to patients, but also helps healthcare providers provide faster and better services. It does so by using blockchain to securely obtain and store patient information. I'd like to ask you to think of Unity sort of like a digital folder, one that contains all of the information that you would need when going to a hospital, such as your medical conditions, prescription, your vaccination records, and even your allergies. And all of this is accessible to you within a touch of a button. Unity is special because it puts the control of who gets access to what back to the patient. Patients can control what to share and who to share it with. And why would healthcare professionals or healthcare providers want this, you ask? The answer is simple. It makes the transference of patient data effortless. It securely uses the same technology as Bitcoins, which means that when you make changes in one document, it makes changes in all the other documents. Unity makes healthcare simple, easy, and secure.
Hello, and welcome to our demo of Unity. It all starts with a login page where you can either sign in if you already have an account or create a new one if you don't. I will run through as though we are a new user and give some info. Here's what it looks like when the info is all filled out. Moving forward from the sign-in page, you are taken to the main page, where you can see your categories like general information, prescriptions, allergies, vaccinations, and sharing, along with a button at the bottom to reveal your medical ID. But because the main goal of Unity is to shift sharing control to the user, we will start with that feature. Now we are on the Sharing Overview page, where you can see all of your shared data, along with what organization it is being shared with at the top. As you move through organizations, Unity will adaptively reflect your sharing preferences for that organization. To change organizations, simply tap and select from your linked choices. It's time for an example. I don't want to share my PCV vaccine with IEPOI, just my other two. All I have to do is turn off the toggle, and it creates a new block in the blockchain with my recent sharing updates, and no longer allows IEPOI access to that information. This concept of giving the user control over their sharing and their data is completely unique to Unity and an industry first, all secured by blockchain. Going back a little bit, we'll take a look at the vaccinations page. Here you will see your most recent vaccinations ordered by relevancy. You will also see at the bottom vaccinations that need renewal and their date received. If you want more information, simply click on the vaccination and you will be taken to a vaccination detail page where you can see how many doses, the lot or professional care clinic, brand administered, and the date of that administration. And as you look toward the bottom, you will find sharing controls for the organizations that you have linked. From here, you can update those preferences anytime. This will conclude our demo of the functional and unique features of Unity so far. Thanks for watching.
The global healthcare cybersecurity market is an enormous and rapidly expanding industry, currently valued at about $8.2 billion and projected to increase to a value of $27 billion by 2025. There is a significant demand for healthcare data security from both healthcare providers and patients. Tens of millions of dollars are lost yearly due to inadequate data security, and unID seeks to alleviate this problem using innovative blockchain technology to provide advanced data security measures and ensure the safety of our data. Upon becoming a national frontrunner in healthcare cybersecurity, we predict a serviceable area market of $500 million. Our software has a few distinct advantages over our competitors. We offer a platform that is both comprehensive and convenient. All of your medical information will be in one place, and we offer safe and secure sharing of select data with providers you trust. Some competitors, such as MyChart, have a comprehensive platform as well, but do not offer a convenient method of rapid data transfer, such as unID. While other competitors, such as Smart 911, offer quick data transfer but are not comprehensive. unID is the only software with both convenience of rapid data transfer and a comprehensive platform. Our business model is based around providing healthcare data security. We plan to partner with hospitals, insurance companies, and healthcare providers to help better secure their patients' data. Our revenue will come from subscription-based contracts with insurance companies and healthcare providers. Our clients will ultimately save more money by protecting their clients' data than our service will cost. Nearly all Americans have expressed concern about their data or their loved ones' healthcare data being at risk or leaked at some point in their lives. Our software can alleviate these fears by providing innovative blockchain security measures.
Our sales and marketing strategy is key to the success of our product. We're going to be focusing on B2B marketing to target directly those healthcare institutions, universities, and other entities who might be interested in using our product. And because each of these customers is going to have wildly different needs, we're going to be focusing on individualized pricing. So you can see the sales funnel on the right kind of mimics those in-person traditional medical equipment sales models where there's in-person meetings and pitches. So we're going to have that initial pitch where we discuss the features of the product and how it could save money and help the customer. Then we'll move forward with an individualized quote for interested parties. We talk about a pricing structure that's uniquely built for the group based on their number of users and length of contract. And we're going to try to make those contracts as long as possible in the beginning to preserve our first to market advantage for as long as we can. And finally, people will sign the contracts based on those individualized quotes. And we hope to have roughly a 1 month turnaround time from the initial pitch through the individualized quote and the contract signing. There's a few key milestones for our process here. First is to develop our initial MVP and our pricing structure and marketing materials. So sort of getting everything ready before we go out into the world. Then we're going to be working on ensuring the reliability of our systems and scaling them up simultaneously as the sales team pitches to some of our key first customers that we really like to partner with. Finally, once we identify a few key partners that we're going to start with, we're going to scale up and pitch to more people and hire an additional sales team to get the job done, as well as developing more of the MVP and kind of refining that as we go. The whole goal here is to increase the rate of growth, hire more sales, and then repeat, because we know our product becomes more attractive as more customers buy into it. Finally, that leads me to our ask and use of funds. So we're asking for $480,000 for a 33% share in our company. That puts us at a $1.5 million valuation, which we do know is a little low considering our total addressable market and our SAM. However, we're looking for a strategic partner who's going to have considerable skin in the game, which is why we want to give you a 33% stake in the company. Because we understand that scaling up this product is going to be a matter of not only our technical expertise, but also connections to get into those rooms where we can really make those pitches effective and make an impact. So this would be our pre-seed investment with no friends and family funding beforehand. And we will be looking for money for our developers, sales professionals, as well as additional sales professionals in the future and technology and marketing costs throughout the process. So as you can see, this is a great investment because our burn rate actually increases over time. So the risk of your investment is actually going to amount more as we become more successful and we have to hire those additional people to keep up. So just to sum everything up, we are looking for $480,000 for a 33% share again. And that's because we want a partner, someone who's going to work with us to help us put healthcare back in the hands of people throughout our country, which is where we believe it belongs. So thank you so much for listening, and we appreciate your support.